Like they said, my name is Sally, and we'll go ahead and get started. So I thought this was a pretty funny little cartoon. And it says, do you take Goldie to be your lawfully wedded primary caregiver? Which, this day and age, especially with people getting married later and later in life, I felt like it was pretty appropriate. So I found this quote when I was doing research for this talk, and I thought that it pretty much summed up everything that everyone feels at some point or another. It's a difficult challenge to care for someone who is here but not here. Here physically but gone mentally and psychologically. You feel alone, and in some ways you are. For many caregivers, it's as if there's a stranger in the house. Can you all relate to that, or feel like that's pretty true? I feel like that this is such a relevant statement, and especially for those who are caring for loved ones with Alzheimer's or any form of dementia, frontotemporal, Lewy body, really any of them. I feel like that this is so appropriate because all of a sudden your loved one who you've lived with all of your life or you've known all of your life is not the same person at all, and you have to reestablish getting to know them. One of my, I run a frontotemporal dementia support group, and one of the wives in there once said that it's like learning how to fall in love with your family member. It's learning how to, reconnect with them and falling in love with them, how their personalities are now versus how they were, 50 years ago when you got married. And I feel like that is so true, and I feel like that really hit home, and I use it everywhere. What are some feelings that you all have as caregivers? They can be good, they can be bad, happy, ugly, whatever. So, fear, good one. All right, anything else? Constant, that's a good one. Anybody else? Overwhelming, it very much is. Anybody else? Frustrating, yes, very much so. I agree, you all are correct. I think that there's a lot of feelings, and I think that everybody has the right to feel different ways. And as you all know, none of these are a constant. A lot of times as caregivers, you're feeling a whole bunch of different things, and it's a constantly rotating cycle, which is okay, but it's hard. It's definitely difficult. Being a caregiver is one of the most difficult challenges that I feel like that we face this day and age. And I'll get kind of more into that in a little bit. But I feel like probably the biggest ones on here are guilt. You feel guilty because you want to go do something for yourself, but you can't. Or you feel guilty because you're upset or frustrated by caring for the person that you love and that you've been with for 50 years. And it's just a lot of, conflicting feelings. Anger, a lot of times, you're angry at the disease, or you're angry at your loved one, or you're angry at yourself. Or a different family member, or whoever might walk into your house that day. If we're going to be honest about things. So I feel like that's a big one too. Stress. I'd say that that's probably the biggest one that everybody feels and kind of encompasses most of these feelings. Trapped, which I didn't put on there. I feel like that holds pretty true. Overwhelmed, which is what we had said too. So do you all feel like these pretty much fit most of how you feel? Confined. Nope, that's a great one. I also want to kind of touch on the fulfillment, love, and satisfaction. So obviously we feel love, because why else would we be doing it? But I know sometimes you don't feel as much love every day as you do some other days. And it's okay to not always feel the love or fulfillment or satisfaction. Some people I speak with, and they feel like that their whole purpose in life was to be a caregiver, and that's wonderful, but they are a minority. It's not everybody that feels like, that they were put on this planet to care for a loved one. It's tough. It's really tough. And same with the satisfaction too. There's just so many other feelings, and I'm not saying that you all don't feel those, but there's just so many other feelings that, it's hard to feel the positive all the time. And that's okay. What is caregiver stress? The definition of it is actually emotional and physical toll of caregiving. Pretty self-explanatory. Those who are caregivers have significantly higher stress than those who are not caregivers, which I'm sure you all can all attest to. Feeling on call. I think that's what someone had said, that it's just never ending. It's all the time, all day, every day. Or, if you're a child who doesn't live with your family, then, you probably live close by, and if mom calls or your husband calls or somebody calls, you feel like you have to rush over there at all hours of the night and drop everything that you're doing for yourself. Role reversal. I feel like that's probably one of the biggest. All of a sudden you're going from parent to child or husband and wife to you being the parent in both situations. Your husband now being the child, or your mom or your dad now being the child. And that's really tough because, you look up to your parents your whole life. They know what they're talking about. You call them for advice. You call them for everything. And then all of a sudden, they're not available to talk with you anymore, and you're the one who's making those big decisions for them. And that's hard. It's hard. It's like you have to grieve the loss of a parent, so then you can take on that role as the parent yourself for, the parent or husband who's now the child. I mean, it's just completely different roles than what you're used to, and that's hard. It's hard. It's hard for anybody. So risk factors, being a woman. So I know not all caregivers are women, but I think I had read, it's significant, the amount of women who are caregivers. I think it's like 80%, mainly because the daughters, the wives, they feel like that they have that maternal instinct to step up and do it. Now, obviously, men do too, especially for the wives, and some of the best caregivers that I've met have been men and, caring for the wives. Absolutely. Absolutely. And I think a lot of women are falling into that role. Like I said, guys do too, but typically, if we look at long-term roles, the women have always been more maternal, and so they're the ones who have always been expected to take care of the house and cook and clean, and typically they just step right into it. And so I do have a lot of daughter-in-laws, just like you said, who do come in and they're caring for their parents who have, Alzheimer's or a broken hip, and then they're also trying to manage and coordinate all of the care for her in-laws too. And that's hard. That's hard. It's just tough for everyone. Living with the person you're caring for. I would say, this goes back to being on call. If you live with them, there is no escape. It's not like you can go back home or, leave. You have to be there all the time. And if they call you, then you're there. It's feeling very trapped. Financial strain, that goes back to taking care of your own parents and taking care of your in-laws' parents and taking care of your husband and taking care of your family. All of a sudden you're trying to manage the finances of everyone. You're trying to manage it for your own immediate family of your husband and your kids, and then you're also trying to manage it for your in-laws and trying to manage their bank statements and their bills that they're probably throwing away or hiding. And then you're trying to do the same thing for your parents. And that's hard, and that just adds so much more stress than usual. So depression, isolation. So that could be more of like social isolation, physical isolation. All of a sudden now you're in this new role where you're a caregiver. You don't have time to go and be with your friends, or you don't have time to do as many church activities as what you used to do, or go play cards or go dancing or whatever you normally do. You don't have as much time for that, and you slowly become more and more isolated, where it's just you and the person you're caring for. And that can be very unhealthy if you let it get that far. We're going to talk about ways to not let it get that far later. So, unable to do what you enjoy, which is kind of what I just touched on. The number of hours spent caregiving, and then challenging family members. I'd say most of you all can probably relate to the challenging family members, whether that's just confusion or, with them hiding their keys or throwing away bills or spending unruly amounts of money, or, it could be more of the wondering, where you're sitting at home and then all of a sudden you're like, where did they go? It's been awfully quiet. And you go to the front door and it's open and they're gone. And that happens quite a bit. Or it could be more of the aggressive, forms of dementia, where they're angry and they're yelling, and all of a sudden, your sweet mom or your kind dad who you've known your entire life is very angry and upset all the time, and you can't do anything right. So, that definitely adds quite a bit to it. Signs of caregiver stress. Weight fluctuation. I don't know about you all, but I'm a stress eater, and I think that probably a lot of people are. So all of a sudden you're not eating like you're supposed to be eating. And this can either happen slowly or it can happen all at once, but a lot of times you don't even notice. All of a sudden you're eating like a 4-year-old and you're swinging by McDonald's every day, for breakfast, lunch, and dinner just because it's easy and it's convenient. You don't have to cook. You don't have to turn the stove back on at home because your loved one's not able to be with the stove. Or, you don't have to plug in the microwave again because they blew that up too. It's just so much easier to just go out and grab fast food. And then all of a sudden, next thing you know, you're, quite a bit overweight. Or it could be the opposite, where you're just skipping meals, where you're just like, oh, well, I don't need lunch. It'll be okay. I'm too busy doing this. I'll just grab an extra big dinner. I hear a lot of people saying that too, where, they just don't have time. They just don't have time because they have a lot going on. Sadness and depression, unusual sleep patterns, alcohol and drug abuse. I know a lot of people drink to feel numb and to feel better, but alcohol is a huge depressant. So if you're already feeling bad, alcohol is just going to make everything so much worse. If you are depressed, I would suggest not using any alcohol at all. It can just make you feel worse and make the whole entire situation worse. Bodily pain. A lot of times stress can manifest in different ways. So whether that's all of a sudden now you have a headache, or, your knee hurts where it hasn't before, or, you're just aching all over. Stress hurts, and so does depression. I know that's a commercial, and it's, probably kind of cliche, but depression does hurt. It hurts to get out of bed, and it makes your whole body ache. So it can definitely be a sign. Exhaustion, which I think we already talked about. Feeling overwhelmed. Loss of interest. So say you do have time to go be with a friend and have dinner who you haven't seen in a while, or you have time to go to a church event, or have time to do something that you typically enjoy, and you're like, I think I'd just rather stay at home. I think I'm just going to watch TV, or I have so much to do anyway, I'm not going to do it. Loss of interest is a big thing in caregiver stress, and that's also one of the signs of depression too, is when all of a sudden you just really don't want to do anything that you're used to doing. Inability to make decisions. I think that when we're stressed, and you all can probably agree, if there's so much on us, it's hard to see clearly, and it's hard to make that path about what we need to do next. Just because you're like, well, if I make this decision, then I have to do this, 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 and this, or A, B, C, and D is going to happen. It's just so hard, and then you're flip-flopping all of a sudden, which just causes so much more stress in the long run. So I think that that's a big one too. And it's okay to feel the way you feel. So I know we had talked about that, the guilt with caregiving, but it's okay. It's okay to feel the way you feel. You are not alone, and it's going to be hard. This isn't what you all signed up for. When you all got married or didn't get married, or, were growing up, it's not like a lot of you said, I think one day I want to take care of someone with dementia, or I think I'm going to take care of someone with a chronic, neurological condition. It's not what any of us typically sign up for. So it's okay to feel the way you do. Never feel bad about the way that you're feeling. And once I think that people embrace that, and this is what I tell people all the time, is once you embrace that, typically you start feeling overall a little bit better and a little bit more at peace with things. I'm not saying that things are going to be easy or they're not going to be stressful, but just remember that it is okay 100% to feel all of those hundreds of emotions that you're feeling all the time. It's okay. I liked this little cartoon too, because I don't think that a lot of people realize, and I'll talk more about this in a minute, is about how much pressure that everybody's putting on you. So if you see, there's parents on one side, then there's your kids on the other, and you're just kind of stuck in the middle, and you're like, how do I have enough life, and how do I have enough breath to be able to manage everything? How do you do it? Responsibilities. And again, I don't think that sometimes people realize about how much they truly have going on. So you have personal responsibilities, whether it's your husband, your wife, your kids, your friends, church, your animals, everything that you take care of on a daily basis. And then you have your work. If you're still working, you have all of that piled on you from work. Then you're caregiving, you're taking care of your personal family, you're taking care of work, and then you're caregiving. So you got to go take care of mom or dad or your husband, like I said, if you're still working. And then just your everyday daily tasks, like cleaning the house or going to the grocery store or cooking dinner. That is so much piled on top of you. And sometimes you just aren't able to breathe. So, which, like I said, I'm sure a lot of you all can probably relate to that too. But I don't think people realize exactly how many different aspects of life are really piling on until you really sit there and look into it. Not a lot of people like statistics, but I only included 4 to keep it brief, but I like these. More than 34 million unpaid caregivers provide care to someone who is age 18 or older, who is ill or has a disability. That's huge. 34 million people. I had no clue that it was that high. I knew it was a lot, but I had no clue that it was that high. That's huge. And that is 2008. So imagine 8 years later. These were the last ones that the CDC came out with, and I feel like they were the most appropriate. Imagine now, it's probably way more than that. Half of caregivers who said their health had gotten worse due to caregiving also said their decline in health has affected their ability to provide care. And I'm sure we're going to talk more about that here in a minute too, but I'm sure you all can probably relate to that. Caregivers said they do not go to the doctor because they put their family's need first. 67% said that's a major reason, or they put the care of the recipient's needs over their own. How many of us do that? I know I do. I have a daughter and a husband, and I know that I put their needs always before mine. And I don't go to the doctor, but I make them go to the doctor 100 times until they're better. I could probably learn from this too. More than half said they do not have time to take care of themselves, and almost half said that they are too tired to do. You are not alone. And that's kind of what I wanted these statistics to show, is that you're not alone in feeling the way that you do. I know a lot of times if you don't have any family or friends who are also caregivers, you feel like you're the only one feeling this way. There are 34 million people who feel the same way that you do. They just might not be in your immediate circle, but again, I just wanted you all to know that you are certainly not alone. All right, preventing burnout. How do some of you all prevent burnout or take care of yourself? Sure. How many of you all are caregivers? So quite a few. How do you all prevent burnout? So how do you all care for yourselves? Or do you all care for yourselves? Okay. Alzheimer's Tennessee has several support groups. Probably close to 50 in this area and the surrounding areas. We have several here at UT as well that I run too. So, definitely support groups are around, and if you all need any information on that, please let me know and I'll be happy to send you that. So it's hard, and that goes back to everyone putting other people's needs before their own. I think that we're raised that way, to not be selfish, and that we need to take care of everyone. Basically just being there. You can't force them to leave if they won't leave, but maybe say what I typically recommend is you can take it in small steps. So you can go over and be like, why don't you go run to the grocery store instead of taking them along, and I'll sit here with him and we'll watch TV, and then when you get back, then I'll leave, and that way it'll just they have 30 minutes alone or 20 minutes alone. So or bring them a meal, and just say, hey, I made a little bit of extra tonight and I thought that you all might like to use it. I think every little bit helps, especially if they're not used to getting any assistance at all or help at all, then every little bit's going to make them feel better. So maybe start out small, and then you can kind of grow it from there. Just because if you jump in and all of a sudden you're like, hey, why don't you go away for a weekend and I'll stay here, they're going to be like, oh, pump the brakes. No. So, but I would suggest starting small. So, or, you can also tell her about support groups, or, if her doctor's office has a social worker, they can always call and see if, they're eligible for any services. There's a lot of services out there that people don't realize that, are either provided through insurance, or provided through the state, or, that are just out there that people don't, realize. So, yeah. Caring for yourself, going to doctor's appointments and the dentist. I have so many caregivers, and, by the time they come into our office, they're so stressed out. They have so much going on. Their hips hurting. They're barely able to walk, but yet they still, get the person on the toilet, off the toilet, help clean up, do all this stuff. What I try to instill in people is what's going to happen if something happens to you. If you aren't going to the doctor and your hip is already hurting, what happens if you collapse, he falls on top of you, you're going to end up in the hospital and there's not going to be anybody to care for your loved one. I mean, and I think that that's the big thing. Again, it's so hard to accept, but I think that that's the big thing. And as a, personal thing, I've taken my daughter to the doctor 3 times in the past 2 weeks. I've had a cough and cold for 3 weeks. I, still, have it. Have I gone to the doctor? No. And this is just how typical caregivers are, is that you put everyone else's needs before yours. And that's why you're a good caregiver, but you've got to take care of yourself or else you're not going to be able to take care of them. Get away for a little while. And I don't mean, go for like 2 weeks down to Mexico, but, like I was telling her, though that would be fabulous, let's be honest. But like I was telling her, maybe get someone to stay with them for an hour and go to the grocery store, go walk around the mall, go to a park and just sit. Some people just need to go sit, just watch, the animals and the birds or read a book. I mean, sometimes it just takes as little as that, just an hour away, to really revitalize you and help you overall just feel better. Stepping back. Sometimes we can get a little enmeshed with our loved ones that we're taking care of. All of a sudden, you're referring to everybody as a we, you think of them as yourself and you as them, and it just gets a little complicated. Sometimes you just need to say, you know what? I think I'm just going to step back for just, maybe a week. Let my sibling, who's been offering to help me for the past, 6 months, who I've been refusing, to come in for a weekend, and I'm just going to go home. Take care of my family, clean the house, do what I need to do, and then we'll come back. Work groups, like I said, there's probably close to 50 in this area and the surrounding counties. There's tons of support groups. There's pretty much support groups for everything. Again, if you all need anything or know of anyone, please let me know and I'm happy to do it. Talking with friends, hobbies, religion, maybe if you haven't been able to make it to church in a couple of weeks, get someone to stay with your loved one so, you're able to go to Sunday school in the service. Again, 2 hours out of the house, to some people, that's really all that they need and is, really fulfilling, especially for church when, if that's a big part of your life. Respite care. A lot of people don't realize, but assisted livings and nursing homes and some hospice agencies provide respite care. Typically, you have to pay for it, except I think if you're on hospice, I don't think you do, but that's a different thing. But, assisted livings and nursing homes provide it. You can drop them off for up to 2 weeks. If you, have a family member who passes away, or if you have an emergency and need to do something, you can always use respite care. Adult day facilities. I don't think people really realize that these are around either. They're adult daycares, and there's several. There's probably close to 20 in the area. There is a fee related to it, but it's not nearly as high as assisted living. And a lot of times the patients who go, they get that socialization that they need, and then it also gives you time to do whatever you need to do during the day. When patients start going, typically they request to go more often. So, if you start off with like a day a week or 2 days a week, typically within a couple of weeks, they're asking to go every day. So just because they've made new friends, they now have a purpose again. A lot of them do volunteer work, whether that's real volunteer work or whether that's, kind of something that they present as volunteer work, but they are pretty great. In-home assistance, there's a lot of caregiving agencies. Typically, they require a minimum of 4 hours at a time, but still, you all can get a lot done with 4 hours at a time if you didn't have to take your loved one along. And meditation and asking for help. Like you said, most of the time we're like, you know what, we have this. We don't need any help. It's put here. I'm strong. I got it. Ask for help every now and then. If you need someone to sit with you, sit with them while you go to the store or while you even go to a funeral or go to a birthday party. Ask someone. More than likely, typically, people are going to be okay with sitting with your loved one for an hour. So I didn't know really where to put this, but I did want to throw in the managing difficult behaviors just because I know a lot of people have them or deal with them on a daily basis. And so I'm just going to briefly touch on wandering. I don't know if you all have ever had anybody who has wandered, but it's very, very scary. All of a sudden they're not there, they're lost, you look all over. I had a lady the other day telling me that her husband, they called the police, all the neighbors were involved. She lived a little bit further out in the country. They had probably 50 people looking for her husband because he darted down the driveway because he was paranoid and thought someone was there. He darted down the driveway and just took off running. And if you're out in the country, there's lots of hiding spots. And so 6 hours later, they found him in a neighbor's bush. So, it's scary. Reducing stimuli, reducing having just a lot of little objects around the house. Curtains or stop signs in the doorway. I know this sounds probably kind of silly, but a lot of times with dementia, if you put a curtain over the door or put a stop sign, then they don't realize that that's a door, or they actually do stop because, you've known your whole life that when you see a stop sign, you stop. And they don't actually go through the door. So that is one way. If you put a curtain over it, sometimes it makes it look like a closet. So they won't actually try to get out. Locks that are difficult to reach. I have a lot of families who'll put a lock up at the very top of the door or the very bottom of the door, or instead of just a little simple turn locks. Exercise. I had read a big article on that saying that if you get your loved one a whole bunch of exercise, or the exercise that's recommended during the day, a lot of times they're not as restless, and they don't tend to wander as much. I'm not saying it's going to prevent it, but it might at least reduce it a little bit. There's also GPS trackers. I don't know about much research on that, but there is a company that makes little GPSs for dementia patients' shoes that you can stick on the bottom of the shoe or attach to the shoe, and that way, if your loved one is a runner, then you at least be able to find them. Aggressive behaviors. I think probably more people deal with this, especially in the frontotemporal world. A good way to kind of combat that is to redirect conversations. So if they're on a tangent about how they really want to drive and the doctor said that they could drive, there's no way that the doctor said that they could drive. Maybe saying, what? I lost something, or, I think I saw something over here that needs to be fixed. Did you see that? And maybe try to redirect them. Typically, most patients can be redirected easily. Routines, that's pretty self-explanatory. Changes in routine really is very difficult for those with dementia. If you have the same thing every day, they know exactly what to expect. So they're kind of like, a child. When you have a young child, routine is best for them, and changing it up sometimes causes a lot of distraction and making them upset. Stay grounded, keep a calm tone, don't yell. Positive, non-threatening body language, limit distractions. You can always call your doctor to see if there's any kind of medications to help them calm down. And don't argue. If you all don't remember anything from this, don't argue is the biggest one. When you argue with a loved one, it's just going to make everything worse. They aren't able to reason, and so it's kind of like arguing with a 2-year-old why they should wear a green shirt versus a blue shirt. It's just not going to work, and it's not going to happen. Don't argue. And as difficult as that might be, I know that we're all used to being able to have rational conversations with our family. Just don't argue. It's going to make your life 1,000 times easier. I promise. And so, they could tell you the same thing 10 times. Just say, oh, okay, thanks. And you're so tired of hearing it and you want to scream, just say, okay, great, thanks. And then just move on. Or, you know what, you're right. And then just move on. So, like I said, it's tough. It's a lot easier said than done. It takes practice, but, it's definitely going to make your life much, much easier. Planning ahead is a good way to reduce stress. Have your power of attorney and living will ready. It can, like I said, reduce stress. Who will care for your loved one if something happens to you? We kind of touched on that earlier. Have a plan in place. Say you do happen to trip over something and fall down the stairs and break your hip, you're going to have to go to rehab. Who do you have that's going to be able to care for your loved one? Make sure your family is involved and informed. And I think that's a big one too. A lot of times spouses have a plan, or one child has a plan, doesn't clue in the rest of the family. then something happens, and it all blows up, and everything is worse in the end. So make sure you have a plan. And elder law attorneys, they are so beneficial. If you have someone who is blowing through money or who can't, make decisions, or if you need to plan, they know how to put your money away where, if they had to go into a nursing home, then the state wouldn't take it in the end. Like I said, elder law attorneys, I can't say enough great things about them. They really know how to navigate the law and all the trusts that are involved to be able to, secure your money for you. So, and for your loved one, and it protects everyone. It protects you if they're, spending aggressively when they shouldn't be. It protects everyone. So what to remember, if you don't take care of yourself, there will be no one to take care of your loved one. I know that we kind of talked about that earlier, but I can't stress that enough. If you don't go to the doctor, check out that hip or check out your foot or, check out your heart, if something happens to you, there's not going to be anyone to take care of them. So, please try to remember, at least get your yearly checkups and try to take care of yourself. For resources and support, there's several in this area. We're very lucky. Alzheimer's Tennessee, Alzheimer's Association, National Institute on Health, they have a lot of stuff online that, is really great information that's trusted information, support groups, counseling services, and then there's also Purple Cities, and they're working hard to make Knoxville a dementia-friendly place. They've done a lot of training around Knoxville with all of the local businesses to make sure that people know how to approach someone with dementia. So they're really great too, and are on a mission to just train and teach. All right, well, thank you all.